So I'm told that the chair of the session is in, and I would want to welcome her officially so that we can start. We had already prayed, and so let's have Dr. Domina Esther from the Republic of Tanzania to take over the chair and begin the process. I hope you already have the program. This morning we are supposed to have one presentation from Brian physically here, and then we get to the side event from Dr. Keo and then Joan. That is free, Dr. Domina. Then after that, we'll have it locked. So please, you are welcome. You can introduce yourself and then you take over.
Thank you very much. Good morning, everyone. For those who are joining around the world, a very good afternoon and good evening, and a very warm welcome to everyone attending this session. My name is Dr. Esther Nkuba. I hold the position of Director of Nutrition, Education and Training at the Tanzania Food and Nutrition Center. It's my pleasure to serve as your chairperson for this exciting session. We will have a 15 minutes presentation from Brian, and it will be followed by many 5 minutes question from the audience. Thank you very much. Mr. Brian is going to present on the VAS Plus Pro, an Android scalable web application, 100% coverage and data quality monitoring of vitamin A deworming and childhood immunization. This work will perfect is under our sub-theme of applied IT support for nutrition and dietetics intervention, addressing the vital challenges of monitoring and ensuring this life-saving intervention. Please join me in welcoming Brian. Brian, the floor is yours, please. Hello.
So, good morning, everybody. My name is Brian Masya. I'm a nutritionist working at Kwale County Government, stationed at Kinango Sub-County Hospital. So my presentation is about VAS Plus Pro program, which is an Android scalable web application for 100% coverage and data quality monitoring of vitamin A deworming and childhood immunization. It is under the theme of the role of nutrition and dietetics in health systems strengthening. So VAS Plus Pro is a computer-based program for strengthening primary healthcare systems through active registration and monitoring of children below 5 years. The initials, VAS, stand for vitamin A supplementation, while Plus is intended to point that there are additional services, that's deworming and immunization. Pro in the initials stands for program. So this program offers a one-time registration of children and their schedules of vitamin A, deworming and measles, rubella 1 and 2. That is MR1, MR2. The program works to flag out all due soon children and provides an on-the-go comprehensive client list of services, defaulter lists with clear biodata, details, and services for which the client is due. So the objective is to create a computer-based monitoring and surveillance tool to provide an effective, efficient, and sustainable method of scaling up of childhood vitamin A supplementation, deworming, and immunization services through real-time monitoring of due soon and defaulter clients that guarantees 100% of achievement of coverage targets while safeguarding data quality. So To validate performance, multiple damaged child health records. I'll use this one. Reflecting national schedules for vitamin A supplementation and deworming and MR1 and MR2 were entered to test functionality, coverage calculations, and alert accuracy. Across repeated test runs, the application correctly identified every child approaching services due dates and accurately flagged or simulated defaulters, specifying the services missed. It produced downloadable defaulter list in PDF, Word, and comma-separated value CSV formats, greatly reducing the time required for manual register checks. The interface proved intuitive, and the reports were well aligned with routine monitoring needs. There was no overachievement recorded during the SS because the performance could not exceed 100%. I will go now demonstrate on how the program works. So as I said, it's a computer-based program hosted on the web. So what happens when you log into the program or when you open the program, the homepage displays the following. The logo is a tab for a tablet to mean or to depict deworming tablets or the vitamin A capsules. And then there is a syringe on the logo that depicts immunizations in terms of measles, rubella, and all other immunization schedules under the KP, AMA AP. So it's under the mantra of Beyond the MCH trademark. Looking at the homepage, not homepage, but pre-logging page, you have the notices tab. The notices tab is used to display updates. For example, when you look at the current notices page, you'll see that it's showing that there's a KNDI 5th International Nutrition and Dietetics Scientific Conference that's ongoing. That's a notice. And then you look at another notice that says that there's an upcoming event from Kwale County for a conference for nutritionists and dietetics on 28th of November, 2025. There's then the login page where registered users are allowed to log in. There's a register tab where users are allowed to apply for registration as a user. I want to point out something. When you are registering as a user, there are certain roles that are allowed. The role that you are registering as determines the level of access to the program. So you have the national, county, sub-county, facility, CHP, and guest users. Those are different levels of users, and whatever level of a user you are will determine the level of access that you have to the program. So I go straight and demonstrate with the login. I have, as I said, you have dummy data that was used to test this program. I'll register with a facility user rights. So when you log in to the post-login page, you'll see there's a dashboard and all those menus. The dashboard basically tells the user, depending on level of access, will be able to display the summaries, how many users are active, the total number of clients for that user. If I'm a facility user, let's say for facility X, and I have 100 clients or 100 children coming for CWC follow-up, we'll be able to display how many clients. To also be able to show you, I'm logged out. So it will also be able to show you the defaulters, if it's a defaulter for technology caps. So you can see we have defaulters. It will be able to tell you how many defaulters have defaulted for vitamin A 12 to 59 months, how many defaulters in your facility defaulted for vitamin A 12 to 6 to 11 months, how many defaulted for MR1, and how many defaulted for MR2. And then after the summary dashboards, you'll be able to see the charts for your facility to show you the performance and performance gaps and performance achievements. So You can see for this facility, Samburu Sub-County Hospital, you'll be able to see for vitamin A 1259, how many, what's your coverage, is it 100%, what is the gap? But then straight to the point, as you said, that it flags out defaulters. If I want to know, like I'm having, as per the program, 3 defaulters for MR1. If I want to see where the defaulters, where do they come from, I'll go to the reports tab. And under the reports tab, I can either send a mail or whatever, but I'll look at the defaulters to draw the defaulters list. So this program will be able to list for you the defaulters, the name of the defaulter. For example, number 1 is Joyce Munga, with the caregiver, the age of the defaulter, and the facility, the county, the sub-county, and the village from where they come from. And then we'll be able to flag out which services has this patient or client defaulted for. The first client has defaulted for MR1 and MR2. So what do I do as a healthcare provider? I just use the guardian's contact list and make a phone call to the guardian. Please bring so and so. They are due for this service. I can as well look at that data and see which villages perhaps are the most affected, the defaulter issues. And then, for example, you can see Samburu T and Samburu T villages have high defaulter rates. You can target interventions, perhaps outreaches, or reach out to the healthcare promoters that area and find out what could be the reason why we're having high defaulter rates from that village. You can organize mobile outreaches to reach to those areas. Again, as you can look at the defaulter format, I mean the defaulter platform, you can download your list either as a CSV, comma separated values, or perhaps Excel, or you can download as a PDF, you can download as a defaulter if you want to email to somebody or for management purposes. You can as well print your list for filing purposes. You click on print, it will send you to the printing platform, and you'll be able to select the printer and print your client list. So essentially, this is the major role of the VAS Plus Pro, and it's just to flag out due soon, to tell you these are patients who are due for this service. If it's MR1, it's MR2, it's vitamin A for 12 to 9 or 6 to 11, or it's deworming, whichever service they are due for or whichever they have defaulted for. So basically, that is the VAS Plus Pro. I will not really get into other details of the program, but I also want to point out that users must be approved. You have a user management tab, which helps you to manage your user. If a user tries to apply to become a user, like a facility user, sub-county user, it awaits approval from a higher level user. If I'm a facility user, I cannot log in unless my user account has been approved by a sub-county user. The sub-county user must be approved by a county user, and the county user must be approved by a national user. In terms of client addition, you click on the add client depending on your level. Only a CHP level and a facility user are able to add clients. Sub-county levels and above can only view charts and dashboards, but cannot add or edit clients onto the program. So if a client comes, you'll be able to fill their biodata, mimicking the CWC and immunization registers. And once you enter the data, it will automatically pick. If I'm a facility user registered for Samburu Hospital, I cannot register for another facility, and I cannot access another facility. And then when you want to view your clients who you've already registered, you click on View Clients tab. You'll be able to see the registered clients, and it will give you a summary of the clients who are already registered. If you want to search for a client or to filter, you can come to under Client tab and perhaps specify a specific client. It will give you data for that client, including what services they have received and what they are due for and when, including their age, where they come from, and all that. So under the user management, every user has their right. Some users have a right to delete, to suspend, or to activate or reactivate a client. So basically, this is in a nutshell the VAS Plus Pro. And I yield my time for any questioning and inputs or clarity. We can't really discuss this in 15 minutes or 10 minutes, but I wanted it to display what it does to generate the defaulter lists for you as a healthcare provider to be able to get them without having to peruse thousands and thousands of pages in your user registers. Thank you very much.
Okay. Thank you, Mataya, for your good presentation. This time is time for for questions. He has presented you well. Congratulations. And this time is for questions from the floor or any additional points, please. You are welcome.
Thank you, Brian. I'll ask you the first question. Now, this tool, is it only for your county or is it a national tool?
Okay, if perhaps the city can display, when you are registering as a user, I have made it scalable actually globally. You can see you'll be able to select the country from where you come from where registering. For now, I've put about the East African countries, but I've also put another aspect of other. When you see you come from other country, then another field opens up for you to say which country. So again, so it's scalable globally. And other than the national user level, there's the overall program administrator who is able now to open for each country their own program account, and then they run their thing. And there's user role designations. A county X cannot view data for a county. Why? So a country user X cannot view data for a country user. They purely manage their data.
So this is your innovation.
It's my innovation.
And are people purchasing it, and who is in charge of the back end?
So people haven't purchased it because, first of all, I've not sold it in the market. I want to sell it to the Ministry of Health. It's more because it has to go for policy issues. First of all, I'm working to work with the county government of Kwale, my county where I work in. Once it's approved for running, because I already presented the facility level, and they are ready and willing to buy the idea. Perhaps from January, be launching it, operationalizing it as a QIT program, quality improvement team program. So I haven't yet sold it out. And number two, running the back end. I am the program administrator currently. So any updates, any changes and suggestions, I just code them by myself. Thank you.
Yeah, I don't know.
You said once you register for under facility X, you can't register for facility Y. So what happens if I move from one facility to another?
Yeah, very good. What happens is, if there's a transfer from one facility to the other, under user management tab, I have allowed a user to only edit their name, their contact details, and their email. You cannot edit your facility. So if you go to facility X, you are going to just edit the details from this facilities. Let's say I'm in facility X and I'm moving to another one. I just go and edit the details for email and for the phone number and for my names. But the data for facility remains. So it takes care of that, such that you cannot move with another person's data. Hope I've answered you well. Let me, if we could demonstrate from the program, if ICT can display me. ICT, can you display my program, please, my computer?
As the program is being displayed also, just give us a hint of the security measures you have for data protection.
Yeah, so for data protection, number one, before, as I said, because of policy issues, I want to work with my county first to roll it out. So number one, before you register in clients, you have to get consent from the clients. And the other issue about data security is that there's password protection for every account, and you manage your own account with your own password protection. A user cannot register twice under the same account. And then there are logs, there are places for logs to show who did what. So the logs are able to show in terms of security parameters, who is accessing what, who has registered what under the logs section. So those are some of the security issues that I've been able to implement, but I'll be open perhaps to better it up. So just to answer you as I wait for the display from the ICT, if user Brian is working in Bagathi Hospital and is transferred to KNH, number one, the superior user can suspend user Brian, but now data will be lost for that facility because the data is not for you. You are just there as in charge for that facility, and that's why you're a user for that facility. So when you get transferred, there's a new user who comes. That new user, you give them the credentials that you are working on. But remember, you registered using your phone number and you registered using your email and your names. So the user who you've given rights now will just go under user management, if ICT could show, and just edit the names, put their names, edit the email, put their email, and edit the phone number, put their phone number. But the county cannot be edited. The facility cannot be edited. So you just edit those three elements to transfer ownership of the program from user X to user Y to maintain continuity of the data.
Thank you. We may not display your computer because it was a third computer.
It's okay.
So it has been disconnected.
It's
So I
fine.
think, Chair, the time for Brian has elapsed. So you can take back. Maybe we are going to proceed with the